5 heart tests you should avoid after 70. They may do more harm than good. Do you find yourself constantly worried about that pressure in your chest? That tightness that seems to come and go, making you wonder if today might be the day your heart decides it's had enough. I've seen it countless times in my practice. Patients come in, their faces etched with worry, clutching their chest, convinced they're on the brink of a cardiac event. And who could blame them? Heart disease remains the leading cause of death for adults over 70. It's no wonder so many seniors find themselves trapped in an endless cycle of tests, medications, and procedures, desperately seeking reassurance that their hearts will keep beating for years to come. But what if I told you that some of the very tests you're undergoing might actually be causing more harm than good? That the medical system, in its attempt to be thorough, might be subjecting you to unnecessary radiation, invasive procedures, and false alarms that only serve to increase your anxiety and potentially lead to a cascade of interventions your body simply doesn't need. Today, I'm going to share with you the 5 heart tests that you should seriously reconsider if you're over 70 years old. Tests that might not only be unnecessary, but could potentially lead to complications that far outweigh their benefits. Before I dive into these tests, I want to invite you to join our community of health-conscious seniors by subscribing to this channel and hitting that like button. And don't forget to check out the first link below to learn about a product that can help improve the heart health issues discussed in this video. Twice as fast as conventional methods. Your heart deserves the best care, but sometimes, the best care means fewer interventions, not more. Let's start with routine stress tests for asymptomatic individuals. You know the drill. You're hooked up to an electrocardiogram machine while you walk or run on a treadmill, or perhaps you're given a medication that simulates the effects of exercise if you're unable to perform physical activity. The goal is to see how your heart responds to stress, to catch any potential blockages or abnormalities before they cause a heart attack. Sounds sensible, right? But here's what many doctors won't tell you. For adults over 70 with no symptoms, routine stress testing rarely provides valuable information that changes treatment plans. In fact, the United States Preventive Services Task Force, a panel of experts in prevention and evidence-based medicine, does not recommend routine stress testing for individuals without symptoms or with low risk factors. Why? Because these tests have a high rate of false positives in older adults. Your aging heart naturally undergoes changes that can mimic the appearance of disease on a stress test, even when your coronary arteries are perfectly healthy. Studies have shown that up to 15% of stress tests in older adults yield false positive results, leading to unnecessary anxiety and additional testing. Think about it. You go in feeling fine, just for your annual checkup, and suddenly you're told there might be something wrong with your heart. The worry alone can trigger stress responses that affect your cardiovascular system, but it doesn't stop there. A positive stress test, even a false one, typically leads to more invasive procedures like cardiac catheterization, where a thin tube is inserted into your heart through a blood vessel. This procedure carries risks of bleeding, infection, and even stroke or heart attack in rare cases. All this for what could very well be a false alarm. I remember my patient Martha, a vibrant 78-year-old with no cardiac symptoms who underwent a routine stress test as part of her insurance company's wellness program. The test suggested abnormalities, launching her into a cascade of increasingly invasive tests, culminating in an angiogram that found completely clear arteries. But the damage was done. Not physical damage, thankfully. But Martha developed such severe anxiety about her heart that she began limiting her activities, afraid that exertion might trigger a heart attack. It took months of reassurance and even counseling to help her regain her confidence and return to her active lifestyle. If you're currently feeling fine, with no chest pain, shortness of breath, unusual fatigue, or other symptoms, talk to your doctor about whether a stress test is truly necessary for you. I'd like to pause for a moment and make a more personal connection with you. Have you ever felt like your concerns about medical testing were dismissed or not truly heard? The medical establishment can sometimes feel impersonal, like you're just another file number in a system designed to process patients rather than care for individuals. If you've ever felt this way, you're not alone. Many of my patients express similar frustrations. I'd love to hear your experiences. Just leave a comment below saying I've been there, or share your specific experience with unnecessary testing. Your comments not only help others feel less isolated in their healthcare journey, but they also help me understand what topics to cover in future videos. Plus, engaging with the content helps our community grow, allowing me to reach more people who might benefit from this information. Now let's continue our discussion of tests you might want to reconsider. The second test that deserves scrutiny is coronary calcium scoring for low-risk individuals over 70. This test uses a special type of CT scan to detect and measure calcium deposits in the arteries that supply blood to your heart. Calcium in these arteries can be an early sign of coronary artery disease, as it often appears in the plaques that narrow arteries. While this sounds like valuable information, for adults over 70, especially those without symptoms or with only low risk factors, the benefits rarely outweigh the concerns. By age 70, almost everyone has some calcium in their coronary arteries. It's a natural part of aging. A study published in the Journal of the American College of Cardiology found that more than 90% of men and 67% of women over age 70 have measurable coronary calcium. Finding calcium doesn't necessarily mean you need intervention. It simply confirms what we already know, that aging arteries tend to develop some calcification. More concerning, though, is the radiation exposure. While a coronary calcium scan delivers a relatively low dose compared to some other imaging tests, it's still radiation exposure that accumulates over your lifetime. For older adults who may have already undergone numerous X-rays, Connecticut scans, and other imaging procedures throughout their lives, adding more radiation exposure without a compelling clinical reason isn't prudent. There's also the psychological impact to consider. Being told you have calcium in your coronary arteries can create significant anxiety, even though it might not actually indicate a need for treatment in your specific case. This anxiety isn't just unpleasant, it can itself become a health risk, potentially raising blood pressure and stress hormones that affect your cardiovascular system. And let's not forget the cascade effect. A positive calcium score often leads to additional testing, which comes with its own risks and costs. If you're currently taking appropriate preventive measures for your cardiovascular health, such as managing blood pressure, staying physically active, eating a heart-healthy diet, and taking medications as prescribed, a coronary calcium score is unlikely to change your management plan. Instead of undergoing this test, consider having a thorough discussion with your doctor about your overall cardiovascular risk and the most appropriate preventive strategies for your specific situation. Remember to like this video if you're finding this information helpful. Your engagement helps us reach more people who could benefit from this knowledge. The third test to reconsider is routine echocardiograms without clear indications. An echocardiogram uses sound waves to produce images of your heart, showing its size, structure, and how well it's pumping. It's a valuable tool when used appropriately, such as when evaluating symptoms like shortness of breath, diagnosing heart valve problems, or monitoring known heart conditions. However, the practice of performing routine echocardiograms on older adults without specific symptoms or clear clinical indications has become increasingly common, despite little evidence supporting this approach. As we age, our hearts naturally undergo certain changes. The heart muscle may thicken slightly, and minor valve irregularities may develop that don't affect cardiac function. An echocardiogram will detect these age-related changes, which can then be misinterpreted as pathological findings requiring intervention. Consider the case of my patient Robert, an active 82-year-old who underwent a routine echocardiogram as part of a senior cardiac health package offered by a local hospital. The echo showed mild mitral valve regurgitation, a common finding in older adults where a small amount of blood flows backward through the mitral valve when the heart contracts. Though this was merely an age-related change with no impact on Robert's health or quality of life, he became fixated on the idea that his heart was leaking. Despite reassurance, his anxiety persisted, leading to frequent emergency room visits for minor chest discomforts that he previously would have recognized as muscle strain or indigestion. The unnecessary echo did not improve Robert's health, it merely transformed a healthy, active senior into a worried patient. Before agreeing to an echocardiogram, ask your doctor about the specific question this test is meant to answer. If you're not experiencing symptoms and don't have a history of heart disease, the test may provide little valuable information while potentially creating unnecessary worry. There are circumstances where echocardiograms are absolutely appropriate for older adults, such as when evaluating heart failure symptoms, monitoring known valve disease, or assessing the heart before certain surgeries. The key is ensuring the test is performed for the right reasons, not simply because it's available or part of a routine battery of tests. If your doctor recommends an echocardiogram, don't hesitate to ask, what specific information are we looking for, and how will it change my treatment plan? A good physician will welcome these questions and provide clear explanations. The fourth test to approach with caution is nuclear stress testing for low-risk patients. Nuclear stress tests combine stress testing with radioactive dye and imaging to visualize blood flow to the heart during rest and exertion. It's more expensive, more time-consuming, and exposes you to significantly more radiation than a standard stress test. For high-risk patients or those with symptoms, this additional information can be crucial. But for low-risk individuals over 70 without symptoms, the added value rarely justifies the increased radiation exposure and cost. Nuclear stress tests involve injecting a radioactive tracer into your bloodstream. This tracer emits radiation that special cameras can detect, creating images that show how blood flows through your heart. The radiation dose from a nuclear stress test can be equivalent to 10 to 15 millisieverts, which is roughly comparable to 100 to 150 chest X-rays or 3 to 5 years of natural background radiation. While a single test at this dose level is generally considered acceptable when medically necessary, it's not trivial, especially for older adults who may have already accumulated significant lifetime radiation exposure from previous medical imaging. Beyond radiation concerns, nuclear stress tests have a higher rate of false positives in older adults compared to younger populations. These false positives can lead to a cascade of increasingly invasive procedures, including coronary angiography, which carries its own risks. I've seen patients undergo unnecessary cardiac catheterizations based on false positive nuclear stress tests, exposing them to procedure-related risks without any benefit. There are also practical considerations. Nuclear stress tests typically take 3 to 4 hours to complete, compared to about 30 to 60 minutes for a standard exercise stress test. This extended time can be particularly challenging for older adults who may have mobility issues, fatigue easily, or have caregiving responsibilities. If your doctor recommends a nuclear stress test, ask whether a standard exercise stress test or stress echocardiogram might be sufficient. These alternatives provide valuable information with less radiation exposure. If you do need a nuclear study due to specific risk factors or symptoms, ensure that the facility uses the lowest effective radiation dose and follows appropriate protocols for older adults. Before I move on to the fifth test, I want to remind you to check out the link below for a product that can help improve heart health issues twice as fast as conventional methods. And if you're finding value in this information, please take a moment to like this video and subscribe to our channel for more evidence-based health advice tailored specifically for adults in their golden years. The fifth and final test to carefully consider is coronary CT angiography for asymptomatic individuals. Coronary CT angiography, or CCTA, is an imaging test that uses CT scanning and a contrast material containing iodine to create detailed pictures of the coronary arteries. While it's less invasive than traditional coronary angiography, which requires a catheter inserted into your heart, it still comes with significant considerations for adults over 70. CCTA delivers a substantial radiation dose, typically 5 to 15 millisieverts, depending on the protocol and equipment used. This is equivalent to approximately 50 to 150 chest X-rays. Additionally, the contrast material used in CCTA can be problematic for older adults. As we age, our kidney function naturally declines, making it harder for our bodies to clear the contrast material. This puts seniors at higher risk for contrast-induced nephropathy, a form of kidney injury. According to research published in the American Journal of Rhodongenology, adults over 70 are up to 3 times more likely to experience adverse reactions to contrast material compared to younger adults. Beyond these physiological concerns, CCTA in asymptomatic older adults often detects coronary artery narrowing that would never cause symptoms or problems. Studies have shown that by age 70, most adults have some degree of coronary atherosclerosis. Finding these changes on a CCTA can lead to unnecessary interventions, including stents or bypass surgery, which carry their own significant risks. Take my patient James, for example. At 74, with well-controlled hypertension but no cardiac symptoms, he underwent a CCTA as part of an executive health program. The test revealed moderate stenosis in one coronary artery. Despite having no symptoms and excellent exercise capacity, he was referred for coronary intervention. Seeking a second opinion, we discussed the evidence showing that for stable asymptomatic coronary disease, medical therapy often yields outcomes equivalent to invasive procedures, but with fewer risks. James opted for optimal medical therapy and lifestyle modifications. 5 years later, he remains active and symptom-free, having avoided the risks of an unnecessary procedure. If you're experiencing symptoms like chest pain, shortness of breath with exertion, or unexplained fatigue, imaging tests like CCTA may be entirely appropriate. The key is ensuring these tests are performed for the right reasons, not simply as routine screening in the absence of symptoms or specific risk factors. So what should you do instead of these potentially unnecessary tests? Focus on proven preventive strategies. Maintain a heart-healthy diet, rich in vegetables, fruits, whole grains, lean proteins, and healthy fats. The Mediterranean diet has particularly strong evidence supporting its benefits for cardiovascular health in older adults. Stay physically active according to your abilities. Even gentle exercise like walking, swimming, or Tai Chi provides substantial cardiovascular benefits. Aim for at least 150 minutes of moderate activity per week, but remember that any amount of physical activity is better than none. Manage chronic conditions like hypertension and diabetes. Regular monitoring of blood pressure and blood sugar, along with appropriate medication and lifestyle modifications, remains one of the most effective ways to protect your heart. Don't smoke, and if you do, it's never too late to quit. Even after decades of smoking, your cardiovascular risk begins to decline within weeks of cessation. Know your numbers. Rather than undergoing advanced imaging, focus on basic metrics like blood pressure, cholesterol levels, and hemoglobin A1C. If you have diabetes, these simple measurements provide valuable information about your cardiovascular health without the risks associated with advanced imaging. Most importantly, maintain open communication with your healthcare provider. Discuss your specific risk factors, family history, and any symptoms you experience. Together you can make informed decisions about which tests are truly necessary for your individual situation. Remember that medical care should be personalized, not one size fits all. Ask questions about the purpose of any recommended test, the potential benefits and risks, and how the results might change your treatment plan. A good healthcare provider will welcome these questions and work with you as a partner in your care. I want to emphasize that I'm not suggesting all cardiac testing should be avoided after age 70. Many heart tests remain valuable tools when used appropriately. The key is ensuring that testing is driven by clinical indications and individual risk assessment, not simply performed as a routine matter of course. I understand that navigating heart health can be challenging, especially when you're constantly bombarded with conflicting information. Living with concerns about your heart can be an isolating experience, filled with anxiety about what each twinge or discomfort might mean. That's why I've created this channel, to provide a community where we can discuss evidence-based approaches to heart health for older adults. If you found value in today's discussion, please take a moment to subscribe to our channel and like this video. Your support helps us reach more people who might benefit from this information. Don't forget to check out the first link below to learn about a product that can help improve the heart health issues we've discussed, twice as fast as conventional methods. Remember, the goal isn't to avoid all medical care but rather to ensure that the care you receive is truly beneficial, minimizing unnecessary risks while maximizing quality of life. I believe that seniors deserve healthcare that respects both their vulnerability and their resilience, that acknowledges both the wisdom of intervention and the wisdom of restraint. As your guide through the complex world of heart health, I promise to always provide honest, evidence-based information that helps you make informed decisions about your care. After all, your heart has carried you through decades of life, and it deserves the most thoughtful care as you continue your journey. Thank you for joining me today. I look forward to seeing you in our next video, where we'll continue our conversation about optimizing health in the golden years. Until then, take care of that precious heart of yours, not through excess testing, but through the daily choices that truly nurture cardiovascular health. One last thought before we part ways. I want to acknowledge something important. The relationship between you and your doctor should be built on trust and mutual respect. If you're concerned about being recommended unnecessary tests, approach the conversation with your physician openly and respectfully. Try saying something like, "I've been learning about the potential risks of routine cardiac testing in older adults. Could we discuss whether these tests are truly necessary in my specific case?" Most good doctors will appreciate your engagement and willingness to participate in your own healthcare decisions. Remember that the goal is partnership, not confrontation. By working together with your healthcare provider, you can develop a plan that addresses your actual health needs while avoiding unnecessary interventions. Your wisdom and life experience deserve to be honored in your healthcare journey. I believe in your ability to advocate for yourself while maintaining productive relationships with your medical team. Now, don't forget to check out that first link below for the product that can help improve your heart health twice as fast as conventional methods. I truly care about your well-being, and I hope to see you in our next video. Please like, subscribe, and share this information with someone you love. I also want to address something many of my viewers have asked about: what tests are appropriate for heart health monitoring after 70. While this video focuses on tests to avoid, there are still valuable assessments that provide meaningful information without excessive risk. A basic annual physical that includes checking your blood pressure, heart rate, and rhythm can detect many concerns. Simple blood tests measuring cholesterol levels, blood sugar, and indicators of inflammation like high sensitivity C-reactive protein provide valuable insights without radiation or invasive procedures. An electrocardiogram, ECG, every few years in the absence of symptoms can serve as a useful baseline. If you develop symptoms like chest pain, shortness of breath, unusual fatigue, dizziness, or palpitations, then more advanced testing becomes entirely appropriate and necessary. The key is matching the level of testing to your actual health needs, not subjecting your body to a standard battery of tests regardless of symptoms or risk factors. Remember, medical care should be as individual as you are. And speaking of individual needs, I've created a free downloadable guide called Heart Health Questions for Your Doctor, available at the second link below. This resource helps you have productive conversations with your healthcare provider about what monitoring is right for your specific situation. Because when it comes to your heart, you deserve care that's truly tailored to you. Before I sign off, let me share one more thought. Many of you have reached out with stories about parents or loved ones who underwent unnecessary cardiac procedures that led to complications. These stories break my heart. If you're caring for an aging parent or loved one, I encourage you to become their advocate. Attend medical appointments with them when possible, and ask questions about the necessity of recommended tests. Our seniors often come from a generation that was taught not to question medical authority, but today's healthcare environment requires informed participation. You have my permission to be respectfully assertive on behalf of those you love. And remember that this channel is a resource for you. If you have specific questions about heart health for seniors, leave them in the comments below, and I'll address them in future videos. Together we can create a community of informed patients and caregivers who understand that sometimes less is more when it comes to medical interventions.